from the station that's on your side. This is Channel 7 News Daybreak.
6:23 is our time. Welcome back into Daybreak. Okay, so the FDA has cleared a Fitbit device. This is pretty unique, folks. It's interesting that this is happening. It's a new heart rhythm monitoring technology. Joining us this morning to explain if this might be the right fit for you, Baptist Health Cardiologist Dr. Scott Davis. It seems like our wearables, Dr. Davis, and you've had one for years, are becoming intricate to our heart health.
Yeah, so you got on an Apple Watch,
That's
right?
correct.
And so the newest technology is now spilling over to the Fitbit.
Okay.
Let's do a backup.
And they were really on the early end of this, correct?
Yeah, right. Yeah. So a lot of what we talk about in this segment related to the heart, we talk about circulation to the heart or the valve issues with the heart, but this has to deal with the rhythm piece, the electronics, the spark plugs, like I tell patients. And so one of the more common rhythms that we're concerned about is this rhythm called atrial fibrillation. Folks at home may have atrial fibrillation, know family members, friends that have atrial fibrillation. And the issue is that it increases our stroke risk significantly, like 5-fold increase in stroke risk. So the better we can identify atrial fibrillation, the better we will be at treating it. And oftentimes it can be asymptomatic, so you don't know you have it. Well, moving into the world of wearables, like you're saying, is Apple Watch was the first then device to get FDA approval to then recognize this rhythm as a wearable. I mean, it's got a sensor on the back of your watch that it can pick up on the rhythm. It's Star Trek technology.
Yeah, it really is.
So then about a year ago, maybe last summer, Google, you may recall, purchased Fitbit, the company that was monitoring the heart rate monitor and, the whole get in your steps and all that kind of Steve Sullivan.
Oh, he should be sponsored by Fitbit. Yeah, he is the step master.
The poster child,
for
right.
Sure.
And so what Fitbit is now FDA approved to do is to identify atrial fibrillation. This affects some 30 million folks in the United States, and they did a study of over 400,000 patients, or 400,000 folks wearing this, and then did a correlation with rhythm monitors like you would wear at the hospital.
Oh, okay.
And there was like a 98% capture rate.
Wow.
So it's very, very sensitive technology. And so
that's incredible.
Yeah. So as we move forward and have this conversation with patients, and we're concerned about, I'm having palpitations, doc, or my mom had atrial fibrillation and I'm concerned, we often tell people, look, don't just immediately rush off to the Apple store and drop $400, $500, $600 on an Apple Watch.
Right.
However, as competition grows, then these newer technologies become less expensive and less expensive. And so now a new player on the market is Fitbit, and that will continue to grow as well. So fascinating technology. It's something you might want to discuss with your doctor if there is a history of AFib, if you do have AFib, because it becomes another tool in our war chest to evaluate heart rhythm.
And it can be monitored on your mobile device or smart device, so then you could just give that to your doctor and say, hey, I don't know what these readings are, but you take a look and you can look at it and diagnose it.
What it'll typically do is capture 30 seconds worth of rhythm that then you can then capture on your phone, your smart device, iPad, what have you. And then also you can print off a PDF of it and go, hey, listen, this was happening about 4 o'clock in the morning about a week ago. And that happens with us all the time. And it's
incredible.
It's fascinating technology.
Doc, thanks so much for stopping by.
Good to see you, man.
Always appreciate you and the technology that you're keeping up with at Baptist Health to make sure that we stay healthy. You can contact Baptist Health by going to baptist-health.com or calling the Baptist Health Health line at 188-BAPTIST.